Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Hemorrhage Control, Episode 2, Hemostatic Gauze.
Our objectives in this video will be to understand the indications for applying hemostatic gauze. We will review hemostatic gauze and why it can be helpful in controlling hemorrhage, and we will go through the steps to show how to appropriately apply this agent. Following the military mission in Mogadishu, Somalia, it was realized that there was a need to develop a new agent that would be beneficial in controlling life-threatening hemorrhage. Hemostatic gauze has undergone military testing and is now indicated for moderate to severe hemorrhage. Both in the military and civilian sectors, uncontrolled hemorrhage is still a significant cause of morbidity and mortality. Indications for the use of hemostatic gauze include wounds not amendable to tourniquet placement, such as the groin, axilla, neck, or large scalp wounds. Hemostatic gauze can be placed in a wound that continues to bleed despite the use of direct pressure. Hemostatic gauze has been shown to be safe to use in both the pediatric and adult populations. There have been no reports of allergic reactions. Therefore, there are no contraindications for the use of hemostatic gauze at this time. There are many different hemostatic agents available for public use. These include combat gauze, WoundStat, QuikClot, and HemCon, to name a few. Only combat gauze is recommended by the Committee on Tactical Combat Casualty Care. The choice of hemostatic agent to carry and use should be discussed with your agency medical director. Combat gauze is a soft, white, sterile, 3-inch by 4 yards long rolled gauze impregnated with the mineral kaolin. The mineral kaolin has been known to promote blood coagulation. It is flexible and easily contours to all shaped wounds. Watch now as the rescuer applies combat gauze to a groin wound with life-threatening hemorrhage. Expose and examine the wound and try to find the source of bleeding. Open the pack of combat gauze and begin to aggressively pack the wound over the bleeding site. Fill the entire wound with combat gauze, including all the edges and corners. Use of the entire dressing will ensure that the proper amount of the hemostatic agent will be delivered in the wound. Once this is accomplished, apply 3 minutes of direct pressure. The 3 minutes of direct pressure is important to ensure that the clotting agent will be effective. Do not lift the dressing to reassess bleeding, and after 3 minutes of direct pressure, bandage the wound to secure the hemostatic gauze in place. This can be accomplished by using any field bandage or elastic bandage. Application review. Again, examine the wound and attempt to find the source of bleeding if possible. Pack combat gauze directly over the source of bleeding. Pack the entire dressing into the wound. Apply 3 minutes of direct pressure and then bandage the wound to secure the gauze in place. Considerations. Occasionally, after packing the wound with combat gauze, there may still be bleeding. Do not lift or remove the dressing. Instead, add more hemostatic gauze or regular gauze to the wound. Always remember, when transporting the patient or moving the patient, periodically check placement of the dressing to ensure there is no active bleeding. After application of combat gauze, the patient should be transported to the appropriate destination following regional trauma protocols.